Hi, I'm Melinda Rodriguez-Tercius. I am one of the nurse practitioners here at Timeless Skin Solutions, and we have Stacy Gotti here today. She's one of our Timeless Insiders, and we're going to be doing a chemical peel for her. So one of Stacy's concerns that she has are some brown spots that she's noticing on her skin. So we're going to do a PCA with hydroquinone peel. It's a great peel to help exfoliate off some of those brown spots and also to suppress some of that pigment. So it's one of my favorites, especially for those of us who struggle with some sun damage. We are going to get started. Are you ready, Stacy?
I'm ready.
All right.
So you hear a voice in the background. I'm just going to ask Melinda some questions as we move along. So Melinda, everybody sees Sex in the City. Remember Samantha's chemical peel?
Yes.
So is Stacy going to experience anything like that?
You know, it's funny that you asked that because I get asked that question all the time. I have not had a patient that had that level of peeling. And here's the good thing about chemical peels. All of them are going to exfoliate the skin more than any of our topical products would. However, we can customize the chemical peels to either peel none or have more peeling. They all, again, are working effectively, but they're customizable. So depending on people's issues and the depth that we want to get to, we can have no peeling or we can have more peeling.
So I've done chemical peels before, but I've always had no peeling.
Right.
So what's happening, Melinda, when you're getting a chemical peel but there's no peeling involved?
Yeah. So Stacy, when you've had those peels with no peeling, did your skin feel tight at some point?
Yes.
Yes. So it's doing the same thing. What the chemical peels are doing is they're dehydrating the skin cells. I'm going to clean your face here. They're dehydrating the skin cells so that those can easily exfoliate off, and then they're helping bring about new skin cells. So it's all about skin cell turnover when we are trying to maintain nice, healthy, youthful skin.
So with the chemical peel, what other kind of treatments can you pair with them, or what's a good, something that you would do together with it?
Yeah, so I like to think of treatments in terms of levels of effectivity. So the most effective thing that you can do to enhance a chemical peel is microneedling. So we do have a lot of patients that'll do a microneedle treatment and then add a chemical peel onto that. That just allows the peel to get in deeper. And then we also do diamond glows with chemical peels. And again, just the exfoliation of some of those dead skin cells that we get from the diamond glow will help that peel penetrate a little deeper. And dermaplaning is another common thing we do with chemical peeling.
So with the chemical peel, and you had mentioned microneedling, can you also do it with Secret RF, or is that not a good combination?
We do not do it with Secret RF.
Can you tell us why?
Secret RF is just a little more intense of a procedure, and we worry about just patients having issues with having too much inflammation and then adding a chemical peel onto that.
So then you had mentioned diamond glow. One of the good treatments to do after a chemical peel is a diamond glow, correct?
Correct. About a week after, you're going to want to exfoliate off the rest of those dead skin cells. So a diamond glow 1 week post chemical peel treatment is a great addition. Stacey, I'm going to give you the stand.
Stacy back for a diamond glow.
All right, so when we're putting the peel on, it might be it's a little tingly, might be a little sensitivity, so we give a fan to just help with that sensitivity. Are you ready here, Stace?
I'm ready.
So can you explain how you apply the swiping motion and what direction and the reason?
Yeah, so I just apply it systematically just to make sure we're getting every surface area. I like to kind of swipe upwards just to pull the skin back as much as we can.
So then once you're done with the chemical peel, what should Stacy expect in the first 12 to 24 hours?
Yeah, so when we do a chemical peel, I'm going to have Stacy rinse the chemical peel off in 4 to 6 hours. After that, she's going to be very gentle with her skin. I don't want her to be out in the sun much. I only want her to use gentle cleanser to just clean the skin off for the next 48 hours. At about that 48-hour point is when I expect the peeling process to start. And at that point, she can apply moisturizers as much as she wants to kind of mat down any exfoliation that she's seeing. Ideally, she doesn't apply anything in that first 48 hours. Some people do feel very uncomfortable though with that tight sensation, so some people do apply some moisturizing agent at that point, and that's okay. It'll just kind of prolong the whole process.
And then are there
Doing
any
okay.
restrictions with the
Yep.
chemical peel?
Yes, there are some restrictions with chemical peel, so I wouldn't want Stacy to work out, and that's hard for Stacy because she's a personal trainer, but I don't want her to really work out much for the next 48 to 72 hours. The reason being that I just don't want her, I don't want her face to sweat is pretty much the reason for that. So walking is fine, again, try to avoid the sun, but no real vigorous activity.
And Stacy, how's it feeling, the actual peel being applied?
I feel a burning sensation right now, nothing too intense, just a slight burning.
So then, Melinda, after the 12 to 24 hours, what should be the next expectation for Stacy?
So after the 12 to 24 hours, again, she's just gonna try to stay out of the sun, gentle cleanser. Once we get up to that 48-hour point, I do expect some exfoliation of the skin. At that point, what I'll have Stacy do is she can use moisturizer to just mat down any of the peeling that she's seeing or the flaking that she's seeing. And that's pretty much it. We're gonna avoid retinol for 7 days, and I'll see her back in a week to get that second diamond glow in. Any questions for you, Stacy?
I don't think so.
This is the very last pass, and we'll be done.